Good day, everyone. Today, we will be reviewing some emotional challenges that you may or may not be experiencing after a heart disease diagnosis or after a myocardial infarction. So for today's agenda, we will discuss common emotional reactions following a heart disease diagnosis, discuss the two most common emotional reactions, including major depression and anxiety. We will review also tips to lessen the symptoms of depression and anxiety. Following the diagnosis of a heart disease, many individuals can experience different emotional reactions or changes in their mood, right, and emotions at the time of the diagnosis or shortly after. Something to keep in mind is that many of these experiences can be considered part of the normal reaction to the diagnosis and often could be an appropriate emotional reaction uh, as well. Common reactions after a heart disease diagnosis could include loss of interest, becoming tearful, crying easily, feeling short temper, having sleep problems, either trouble falling asleep or maintaining regular sleep at nighttime. You could be waking up multiple times or even having bad dreams, changes in appetite, changes in sex drive. There might be some forgetfulness, and there might be some intensive preoccupations about the diagnosis that are difficult to clear from your mind as well. The good news is that many of these emotional reactions typically resolve within the first 2 to 3 months after the heart disease diagnosis or after a coronary or heart attack. However, something to keep in mind is that if your mood is not improving or you feel stuck, it is important to get some support and to see what's going on, and then you may need extra help. So if your mood is not improving, uh, your emotional concerns at that time could be due to a major depressive disorder or major depression or due to anxiety. Let's review quickly major depression after a heart disease diagnosis or after a coronary artery disease or a myocardial infarction event. Something to keep in mind is that about 1 in 6 patients with heart disease may report major depression. This is information obtained from uh, our records based on the literature. About 15 to 30% of people can develop a major depressive disorder after a heart disease diagnosis. The symptoms could include profound feelings of sadness, a lack of interest or enjoyment in most activities, thoughts of self-harm or suicide, and including hopelessness as well. When it comes to anxiety, about 1 in 4 patients can develop some anxiety symptoms after a heart disease diagnosis. Based on some the research literature, we know that about 20 to 30% of patients may experience some elevated anxiety right after the diagnosis of a coronary artery disease, for example. And although anxiety after a myocardial infarction may be transient for some patients, in about 50% of those patients, anxiety can persist for up to 1 year after the event. Something to keep in mind because you might be experiencing some challenges and need extra help. Symptoms of anxiety that you may want to pay attention to include feeling irritable, fatigued, being restless, difficulties controlling the feelings of worry, feeling that you're out of control or of impending doom. You may even experience symptoms of panic attacks such as elevated heart rate, heart palpitations, or shakiness. If you find that your mood is not getting better over time, that you're feeling stuck with these feelings, or worried that you may be experiencing depression or anxiety, it might be important to get some help. Some people may have questions and benefit from speaking to a healthcare provider to get some extra information about your health and what else needs to be done in case you might be having some of these conditions. You could share your worries with a family member or other healthcare providers as well, either your cardiologist or the cardiac rehab staff. You may want to learn about community resources as well that can help with home care, transportation, as well as some other social activities that might help with your mood. You may consider enjoying some physical activity and exercise as it might help reduce either depression or anxiety. Many individuals journal, and that might help keep track of their emotional experiences. And finally, mindfulness could help with these symptoms as well. So you may be wondering, where can I find some extra help if I'm experiencing emotional challenges after a heart disease diagnosis? As mentioned in the previous slide, you can speak to your exercise therapist through the cardiac rehab program. You can speak to your family doctor or someone on your healthcare team, such as a cardiologist, or you can call a local health crisis line. The treatment of this condition, such as anxiety and depression, could include one-on-one counseling and also in group, and this can be done virtually over the phone or online. Other strategies like meditation can help as well. And finally, some individuals may require medications to help with their symptoms. When we speak about strategies to help with emotional challenges after heart disease diagnosis, there are several other activities that you can consider to engage in to promote well-being. Activities that can promote well-being include being grateful, think about strengths and resources that you might be used in the past, enjoyment, finding meaning in the things that you do, and also practicing some calmness. For example, when we talk about being grateful, we think about reflecting on positive events with friends and family members, expressing gratitude to others might help you cultivate well-being. When we think about strengths and resources, we think about how you may have approached similar situations or challenges successfully in the past, and how can you apply this to your new situation, in this particular case, being diagnosed with a heart disease. Also, when we talked about enjoyment, important to schedule some activities that you enjoy, such as reading a book, watching a movie, as these activities can help you feel better about yourself and find some enjoyment. When it comes to finding meaning in activities, important to include in these activities things that you find meaningful. And it could be things like woodworking or photography. Some people might find it meaningful to clean a room in the house or painting. Think about those activities that you have engaged before that you find meaningful, and you may want to engage in those again if you're experiencing emotional challenges after a heart disease diagnosis. And finally, how can you practice some calmness? And this could include engaging in deep breathing exercises, meditation, or even listening to relaxation music. Mindfulness can help us achieve some calmness as well, and although it may be challenging to achieve, the idea of mindfulness is learning how to be fully present in the moment, aware of your thoughts and feelings without judgment. It can be practiced anywhere and at any time, but best to start in a quiet, comfortable position. Next, please join us in a mindful moment for you to get an idea about what mindfulness could look like when you are at home engaging in this activity.
Hi, and welcome to your mindful moment. Don't worry if you've never done anything like this before. All you need to do right now is to get comfortable, preferably sitting upright in a chair or seated comfortably on the floor. So take a moment just to get comfortable. Sitting with your eyes open, nice soft focus, and if it feels comfortable, taking a couple great big deep breaths, breathing in through the nose and out through the mouth. As you breathe in, noticing how your body expands. As you breathe out, notice how your body softens. And with the next breath, gently close your eyes. Just allow your breath to return to its natural rhythm, in and out through the nose. And just take a moment just to settle into the space around you, becoming more aware of your other senses, the contact between your feet and the floor beneath you, noticing any sounds, just allowing them to come and go. And then, as you bring your attention back to the body, noticing how the body feels, and then letting go of that focus, letting the mind do whatever it wants for a few seconds. If it wants to think, let it think. And then bringing the attention back to the body, the feeling of contact, starting to notice the space around you, any sounds, and then when you're ready, in your own time, gently opening the eyes again. So how does it feel, having taken a few moments out of the day? Does the body feel any different? Does the mind feel any different? Don't worry if there's still a lot of thoughts. That's perfectly normal. Remember, this is a skill and it can take a little bit of time. For now, it's just about creating the right conditions. Not trying to stop thinking from happening, but trying to create a little more ease and comfort with each passing thought. And congratulations on taking this moment out of your day to practice a mindful moment.
Mindful meditation is available in every moment. There are several resources available. Please visit gethearthealthy.ca for more information about this. Finally, I would like to summarize what we cover in these slides today and this presentation. Again, many people can experience changes in their mood and emotions at any time after a heart disease diagnosis or shortly after. The positive thing is that many symptoms resolve within 2 or 3 months after the diagnosis. There are things that you can do to make those experiences better. Speak to someone in your healthcare team for support as needed. For more information, again, you can speak to your healthcare team or exercise therapist through the Cardio Rehab program. And please visit our website for more information.